Hi everybody, my name's Jonathan Hindley. I'm 55 years old and I live in Manchester. And one of the main reasons why I've done this video is that on the research that I was doing prior to my operation of a full knee replacement, I was always finding that the people that were giving advice were the people that weren't actually having the operation. So I wanted to do something to give back to the people that are going to have the operation and what to expect. So this first video is the first week of what happened. So initially I've been on the NHS list for 18 months. I'd originally made some inquiries going over to Lithuania to get it done by a friend who'd had his done there. It worked out about £7,500, but then I spoke to my brother-in-law who'd had his done with the privately through his company insurance, and he said, please don't go abroad. It's going to be, if you're stuck out there, something happens, you're not going to have any family there. So I stuck with the list. I was very fortunate because I live in a community and the hospital is 500 yards away from my house, which is the first NHS hospital in the UK. Which is Trafford General, used to be called Park Hospital. So as you can see, this is almost double after a week. So initially I got the phone call while I was on holiday in Bosnia, and they gave me a week's notice. I had two pre-op appointments, which went great. They gave me all the drinks and the tablets that you need to take and the whole scenario. But what had originally happened was that they offered me a date, and it was something that didn't work with my workload was too much for me to actually say yes, go ahead. So I had this. So we're talking what we're talking now. We're talking 2 weeks ago. So yeah, 2 weeks ago. So it'd have been mid-June 2024. So I was in Bosnia. I said, yeah, no problem. I was with the wife. Never told her because she was shopping. Got on the coach. Told her. Fantastic. So then obviously we got back into the UK 2 days before the operation. So it was all hands to the pump. If there's any advice I should give you, it would be prepare. And if it wasn't for my wife, typical man, it'll be all right. But I promise you, you need to be organised. So what I did is I've got my own business, set my which I'm working from now, like an office station in the kitchen, which I work from remotely, which is great. And we've got a 3-tier house, so I'm on the top of the house, and getting up there was going to be a problem. So basically, we swapped all the beds around. I moved down to the first floor, and it was only one set of stairs getting up. Made sure that everything was in place, from underpants, t-shirts, everything that you need, toiletries, quilt, and then basically just listen to what the nurse said to me on the phone about I had to come off so I was I had a stroke, full left side, lost everything when I was 42. So as you can see, I have made probably 95% recovery. It's my left side, but when I get tired, I trip up. And funnily enough, it's actually my left knee that needed the full replacement. So I didn't know what to expect. They told me to come off my blood thinner and then go on aspirin, 75 mil aspirin for a week prior to the actual operation. So I purchased them obviously while I was in Croatia, Bosnia. Took them for a week, no problem. Came off me, I think it's clopidogrel, which is controlling my. No, I didn't. I didn't come off that. It was controlling my cholesterol. I was still taking that. So I went into the hospital first thing in the morning. Checked me in. I have to be honest with you, I was absolutely shitting it. I went when 7 o'clock in the morning. My actual sister works at the hospital where I was having the operation as well. So sort of like when you check in, it was really nice because it was like, oh, hi John, how are you? And yeah, and I said, well, I'm needle phobic. Yeah. So they were the things that that played on my mind a lot. So what happened then is I went down to the ward. They checked me in, made sure that everything was I had an overnight bag for two things, 2 nights overnight. So they put me in a waiting room. I must have seen, before I went down for the operation, I must have seen 8 to 10 different people. And they were, the NHS, I cannot fault them. They were absolutely superb. From what I wanted for my dinner, for breakfast, pain threshold, you know, put a gown on. One thing I would mention that I didn't do, I didn't take a dressing gown. So I ended up with 2 of the hospital gowns on, one back to front to each other. So take a dressing gown, that is one thing. And I turned up in shorts. Shorts, it is a must for a male. And underpants. So, but when you get there, bollock naked, put your gown on, sit there. So I sat there because the guy that was before me was in the next bed in the waiting bit. His name was Mike. He was roughly about the same age as me. So Mike goes down at probably around about 10 o'clock. I get told I'm going to go down about 12 o'clock. The anaesthetist came to see me. She said to me, right, you've got a choice. We can either do an epidural and we'll sedate you. So you will hear things, you won't see anything, put your AirPods in, or completely knock you out. So I'm like, well, spoken to my brother-in-law, he's told me the worst scenario is being put to sleep completely. Because the recovery time that you have when you come round is a lot longer if you've been put to sleep than it is through an epidural. I'll be honest, I was absolutely shitting my pants. I'm not the best, but you know, going through a stroke and nearly died on one occasion as well, falling off a roof. That's another story. So I have been through the mill. I'm not good with needles and stuff like that. So they came and took me away, probably about 1 o'clock. Took me down into this little waiting room, and I was just white, completely white. And the anaesthetist that came over to me, she was just so nice. So I had my AirPods in, tried to switch off from everything. And as I was sat in this little waiting room, Mike comes out on his trolley into the recovery area, and I can hear, even though I've got my AirPods on, I could hear what they're saying to him. And I'm thinking, shit, this is going to be me when I come out of my operation. So I finds out that Mike has, because he's basically the next bed to me once I'd had mine done, he'd had an epidural. So he was semi-conscious when he came out of the operating theatre. And I was sat there, the anaesthetist said to me, right, I'll leave it with you 5 minutes and I want your decision. She comes back in, she said, I've made the decision for you. So I said, why? She said, because I can tell by your face you're anxious, you've gone white, you've gone very pale, you don't look comfortable. What's happening? She said, I'm going to knock you out completely. I said, oh, great, fine. Gets me on the trolley, wheels me into this room. I've got my AirPods, and I've had to put my phone, because it's playing the music, in a plastic bag. I've got my AirPods. She said, take them off, put them on the side there. What were you listening to? Funny enough, I had a random playlist, it was Elvis. She went, oh, Elvis. And the way that they helped me calm myself down, because they do it every day, was fantastic. The doctor had actually come to see me while I was waiting to go down to theatre. And he said, listen, it's pretty routine for me. His name was Dr. Gilbody. He was marvellous. And he said, well, I'll just open you up and we'll go from there. So what had happened, my knee had 2 operations on the cartilage, keyhole, through sport, football, everything over the years. They'd not healed. So I've been walking around with a limp for about 2.5 years. And I wasn't noticing that. It was my family and my friends saying, what's the matter with you there? Well, and I'd had consultations, I'd had x-rays, and basically it was bone on bone. On the inside, I think they grade it 1 to 4 on either side. So it was 3 on one side, 4 on the other side. And I wasn't in any pain at night time. It wasn't keeping me up at night, but it was uncomfortable, like getting up off the settee, like carrying weight, because I'm a mobile DJ at the night time as well. So over the years, carrying equipment, and it was getting more and more painful. And over the years, I'm more like a cabaret DJ, so I was dancing as well. So I'd do a night dancing, I won't be able to walk the next day, and it was just blowing up, blowing up, blowing up. And it was affecting my right side of my body as well, my hips and my right knee. So I knew that something had to be done. So anyway, going back to obviously taking me into the pre-anaesthetic, they just made me feel so comfortable. Mask on me, boom, straight out. Absolutely didn't know what day it was, in a good way. Next thing you know, in the ward, and I'm coming round, waking me up. John, wake up. Right, okay, your operation's done. I'm thinking, fuck, that is the best way. For me, that was the best way that I could have been put to sleep and my anxiety completely gone. And it was really good. So this is a week ago, and I'll do another video in another week. And like I said, this is just to help people, because people that are telling you how to do whatever you're doing and go through, they haven't had one themselves. And when I had my stroke, I wish I'd have done this. So this is why I'm doing it. And I've got another friend who 2 weeks earlier had her knee done. So I had a FaceTime with her yesterday. We had a bit of a chat about how it affects you and everything. She's a female, male. And yeah, so I came out. Within an hour, they had me sat up on the edge of the bed on 2 crutches, bending my knee. And I was thinking, fuck, no, it can't work. It can't work. But yeah, I sat on the edge of the bed, moved my leg a bit, up and down with the foot. That was the first one. But yeah, they just made sure that you could move it. So when I was in the ward, obviously, Mike was on my left-hand side, and another guy was opposite me as well. And the other guy opposite me had his knee done, and he was is having his other knee done in another 3 months' time. So with regards being put to sleep as opposed to having an epidural, as an example, the guy that was next to Mike in the bed, he had an epidural. And what had happened with him, obviously it's numbness from the waist downwards. He had his done like 4 days earlier. But what had happened is he wasn't, they weren't going to release him from hospital until he could pass water. And this was a big problem for him. So in the end, he couldn't do it because he had no feeling, or it wore off, but something happened and they had to put a catheter in for him to pass water. And in the end, he managed to do that and they let him home. So I'm not too sure why he couldn't pass water, but it was because of the epidural. So there's pros and cons. Personally, you know what I went for, so you know where you're at. Anyway, so it was all about rehabilitation, doing your exercises, and the physio. Luckily enough, one of the physios is the son of one of my mates, so that was helpful. Within the first day, I'd made it to, so I came back in the afternoon. They got me up within an hour, spent overnight. Temperature, I had low oxygen in my blood, so I had to wear a mask on the first 2 nights. And that the nurses know what they're doing. I was on pain relief, I was on morphine, I was on the morphine tablets, I was on 5 ml of morphine liquid, I was on paracetamol, I was on the, I think it's the one that for your muscles and everything, I was on that as well. So yeah, it was just doing what they were saying for me to do. And on the first, so I woke up the next day, got up in the morning, I thought, I'm going to make it to that toilet. So two crutches, got to the toilet, bit of a struggle, but speaking to other people, it's all about exercise. Keep moving, do your exercise on the bed, make sure you're comfortable, lift it up. always try and get the top of your toe, your big toe, above your nose and elevate it up. Pretty hard to get comfortable in a hospital. And then what had happened is came to the second day, made sure that obviously, I was doing my exercises. But please, if there's one bit I can give you is don't push it too much, because I tell you what, the swelling on the leg, it's like your body goes into shock. And I hope that whoever watches this, your body doesn't reject your knee replacement. And the surgeon came to see me the next day and told me I've done a complete knee replacement, and your kneecap was really, really damaged. So what I've done is I've put a disc under your kneecap to help you with the whole process of you being able to walk properly again. So that was really helpful. So yeah, they call it major surgery. We're a week on and I'm on no pain relief whatsoever. And I'm only taking it just because I'm thinking, I better take that just in case there's a bit of an issue. So for the paracetamol, that's what I've been on. Nothing too heavy. I'm not in no pain. More than anything, it aches. But then again, that's your body telling you you've done too much. So they give you leaflets. They give you the exercises to do on a pamphlet. And one of the things that to release you from hospital is being able to move your leg. I think it's 70 degrees. And I wasn't hitting it, and I was really frustrated with that. And obviously the 2 steps, landing, 2 steps, back up again with the crutches. And obviously them telling you how to use your crutches properly, because we all think we know it, but you don't. So yeah, it got to I had the operation on the Tuesday afternoon, stayed in Tuesday night, stayed in Wednesday night, and it came to Thursday afternoon, and I'd informed my wife that I wasn't coming home. I'd not hit my target. But they said that I was really, really close. So there's no point in putting you in overnight. The other 2 had been discharged next to me, and more were coming in. I'm thinking, oh, shit, I'm here on my own. Anyway, I get discharged. I get home, got all my tablets and all my medication with me. And if there's one thing, please follow the instructions for your medication. If you break that cycle, it just sets you back a bit, especially on the ones that are for the gastro. I think it's the gastro. I'll go and get them in a minute. And and then getting home. Now, when I say being prepared, try and put a sock on. Fuck. It really, really is difficult. And I've had to have help. Done my exercises, been on it, raised my leg, sat down, bit of work. So the first night at home in the new bed, I didn't have the one that I had upstairs in the higher part of the house. I didn't have my own mattress. I had a memory foam mattress, and it was, it was you've got to get your own mattress. It was the one that you've been sleeping on every day, every week, every year. You will not sleep otherwise. I did struggle sleeping the first night, and then it was on, off. One thing you do need to remember, especially being a man, is take something to wee in, because you do not want to be getting up in the night. Drink plenty of water. Definitely take something to wee in, because you don't want to be getting up. I've been quite fortunate, really, because I've got a good family, and they look after me. And the wife was off for on the Thursday, the Friday, Saturday, the Sunday. Then it came to Monday. We're now on Wednesday morning, and she went back to work on Monday. So on Monday, doing my exercises, but what was restricting me was the amount of swellingness in my leg. I had it cleaned up before I came out. I don't know whether you can see it or not. It's there. I've got an ice pack on at the moment. I've just done my exercises, but yeah, yes, I'm not very technophobic. I'm not very technical here. So, yeah, to clean the wound up, I had to leave the wound dressing on for 2 weeks, which is going to be next Tuesday afternoon. And I think that's when the staples are going to come out. So you get about an average of 35 staples in your knee. Mine bled quite heavily, so they cleaned that up before I actually went home. I've got a couple of dressings in case anything happens. They've told me I can't have a shower for 2 weeks, and I tell you what, Jesus Christ, these here are the best things you can use or get stocked up with or prepare yourself for, because I tell you what, the smells, oh man, honestly, smell like a Bombay Dockers underpants. I'm telling you, these, it's honestly heaven. It's like being at Glastonbury for 2 weeks, telling you, they're good. Make sure you ever wash. But yeah, I'm dying to get in the shower. I'm going to have a shave tonight because of why I'm saying I look like a bloody tramp. So yeah, and so it came to Monday. We're on this week now. It came to Monday. Wife goes back to work, thinking, right, okay, do a bit of graft at home for the office. And then I think to myself, right, by Sunday, I'd gone down to one crutch. And I'm getting a bollocking all the time from the wife. And I'm saying, no, I'm going to do it. I'm going to do it. So I'm on the one crutch for the Monday. I think to myself, you know what? I'll walk the dog round the block. Bad idea. Well, we're talking probably, I think the count was about 1,200 steps on one crutch. So I took him round the block, made it home, completely and utterly wiped out. Came home, the wife thought I'd been beat up because I couldn't even speak properly. I was that tired. That was a big mistake. That set me back, and set me back the next day as well, which was yesterday. So basically nothing yesterday. Did a few light exercises, but nothing. But seriously, and the same happened when I had my stroke. I tried to recover too early, and I wasn't letting my body recover. So when I had my stroke, it was 1 day on, 1 day off. 1 day on, 1 day off on exercises. Because you think you can do it, your head's telling you can, but your body is in shock. With regards, your body being in shock with a knee replacement, what I would say to you is that sleeping at night is very, very difficult. I'm going to ask for something to knock me out tonight because I've not been sleeping. And the main reason being is I'm in bed. The activation that's in your leg, because your body's fighting what's happened to you, it's like in shock. So what happens is your leg gets very, very warm. If you put your hands on it, it's really, really tight. It's really, really warm. And this is because of all the muscles and all the nerves that have been moved around and touched with. And it's your way of coping. It's your body's way of coping. So that is the main reason why I've not been sleeping. It's very uncomfortable. I've got like a sheet. It's like, I explained it to my wife and she said it's like going through the change where you need to be warm up top, but your legs, need to be cold. It's like having a window open all the time when you've got a 15-ton duvet on. So yeah, trying to explain it's quite difficult. But yeah, up and down, up and down, and up and down. So I'm still on one crutch. I've done all my exercises this morning. So I've done a bit of a plan. So my plan is, and the reason being I've done a plan, it gives you something to focus on. I'm starting at 10 o'clock, 2-hour intervals. I do 10 bends of the knee, just on freely, 10 bends. I do a side to side, 20 times. I do it in 10s, 20 side to side, holding onto the table. Side step, side step, side step. I put a plate on the floor and do that with my knee 10 times. We've got a back step, which is probably only about that high. So I hold on to the patio doors at the back of the house. Up, down, up, down, up, down, 10. And I also bend the knee with my feet on the floor, with my toes pointing downwards. And I have one of these elastic things here. So I strap that round a post, strap that bit round my knee and pull it like that. Do 10 of them, put that bit there round your knee and that round the post and pull it like that. Works really well. So do them on 2 hour intervals, then put a bit of ice on it, do a bit of work. So I do that 10 o'clock, 10 a.m, 12 p.m, 2 p.m, and 4 p.m. and rest then. So another thing here, this came from my brother-in-law, this is absolutely, it's going to be difficult for people because I know money's tight with people. This thing here is just the absolute best. So what it is, 5 big ice cubes in there, and then you fill it up to water about there. This is your feeder pipe. This is your clip here on the top. You leave that's your air. So you have that shut. Open it up. Stick your stuff in there, right? Put your water in. Put your 5 cubes in it. Leave it 5 minutes. Seal it all up. And then what you do, you've got this. So this is like this goes round your knee, and I tell you what, it's brilliant. It's brilliant. Okay. This here. So what you do is you put this round your knee, and the coverage on it is brilliant. So this is the pipe that leads from the water. This has to be elevated at a high point, so gravity takes the water down. And this is your clip. So what you do is you put that around your knee, open the valve, stick the valve in there, and it fills up with ice cold water. And then when it gets warm again, put it back on. It's brilliant, absolutely. Now, I believe they're about £110, but it's the best money you'll ever spend. And they're called Aircast. It's called a Cryo, CRYO /cuff, CUFF. And they are absolutely for cold and compression. You can get one of these, it'll make your life a lot better. But at this moment in time, I am, just for speed and just for, I'll take it off now because it's been on for about half an hour. I've got one of these there, which another person that I know who's had a knee replacement has got one of these. So these are about 20 quid. These are gel. Stick it in the freezer and yeah, you're away. I promise you. Get the ice on it as much as you can. Now, that previous contraption there, I put that on too tight one night. And I tell you what, when I took it off my skin, there was dints in it where I put it too tight. So don't do it too tight if that's one thing that I need to remind you of. Anyway, I hope you've enjoyed it. This is my experience. And the reason why I'm doing it is to give something back to the people that are a little bit apprehensive about it. I'll promise you, it's feeling good. It's getting better. I'll do another update next week. Take care. John in Manchester. Thank you.